Okay, welcome to a little bit of waffle. Waffle, that does it a disservice really. The PAILs and RAILs technique that we use within the FRC system that simultaneously strengthens and expands simultaneously expands and progressively strengthens usable ranges of motion. Okay, it is isometric work that can then lay the foundation to dynamic work and then more sort of traditional strength training further down the line. It is a very useful tool, and you will see it dotted around throughout all of the stuff and the programming that I provide. I'm going to do a demonstration both on lower body and upper body so that you can get a sense of the language that we use being the same and the system being the same and the setup really being yours to sort of interpret, because as I always say, intention is more important than position. Now, regardless of whether you're doing progressive angular isometric loading or regressive angular isometric loading, we use a ramping technique. And the ramping technique is referring to the ramping up of contraction or intensity of contraction. I use the sort of visual or mental cue of a volume dial. All right, other people count. But I think the dial really works, okay? You don't just jump in straight to 100%. We want to be targeting tissue, targeting angles, okay? And then increasing the layering of contraction that is then sent back to the nervous system as information saying we can create strength in these end range positions, which then leads to you keeping more of that range. Together with the passive element, this is how we push the dial, okay, push the dial up and increase flexibility, and then make sure that we keep it rather than it snapping back, okay? So I'm going to use my wrist, it's a nice easy one, as an example for how to use PAILs and RAILs. So side on, just my one wrist really. And what I'm going to do is I'm going to take my wrist into wrist extension. So here in my wrist, I keep a flat palm, and then I'm going to lean forward. Okay, this creates, as you can see, an angle at that wrist. That angle, as with all angles, has two sides. Okay, it has an open side, which is this side in this instance, and a closing side. You can see that more when we start to move. Okay, opening this side, and this angle here is getting shorter. Okay, progressive angular isometric loading refers to the open side, regressive to the closing side. That is the same regardless, okay, whether you're doing big toes, little toes, rib cage, it doesn't matter. That's the beauty of the system. You can just use the same language and it works just the same. So I've taken myself now to my end range passively. I've stayed there for an amount of time, normally about 2 minutes. Okay, normally about 2 minutes is enough time to let the nervous system calm down. We use relaxing breathing there. And the order that we normally go in is to then load the progressive tissue. So this stuff that's being stretched, I would then want to actively load that. Okay, so in this example, in order to get this tissue loaded actively, I would think about gas pedaling. Okay, gas pedaling my hand into the floor. So I'm basically trying to get it straight. Depending on the position, normally it means pushing into the resistance. So I have created resistance with a very solid object of the floor. If I was doing a shoulder, for example, I've gone in here, I'm creating resistance with my hand, and then I would push into that resistance, and that would almost certainly elicit the PAILs contraction. So back to this example. As I've gone forward, I stay as far forward as I can or as comfortable at my end range. And then I slowly get into my mind that idea of the dial. So I'm going to start gas pedaling my fingers and hand into the floor. 5%, 6, 7. You may want to go a little bit faster than that, but gradual, pushing down more and more. Now, depending whether you're using this for rehab, warm-up, or as an actual training tool, sets and reps, will depend on how heavy and high the intensity goes. If it's rehab, we're talking like 10 to 30%. If you're warming up, well, you know, one at a low percentage, one medium, one high. If you're using it as a training tool because it's really important to you to be able to open that up, okay, you're going to need to use at the right time high intensities, just like you would need to use high loads when you're doing normal S&C training. Otherwise, you're just not going to be providing enough stimulus in order to adapt. So I'm pushing down, pushing down, pushing down. The sensation is on PAILs, okay, on the progressive angle or the open side. I hold my percentage, whatever that is in my program, for the allotted time, and then I would then immediately switch to rails. Now, you don't just go immediately to the same intensity. What you would do is you would dial up on the regressive side. So in this instance, I would want to train all the stuff on the closing angle, all the stuff that would help me close that angle more. So in this instance, it's thinking about pulling up my fingers, pulling up my hand, pulling up through my forearm, okay? But again, it's the same thing. Doesn't matter whether you're doing big toes, little toes, rib cage. Regressive tissue is the closing angle side. And I'm really trying to use all of that stuff in order to pull me deeper. Okay? If you're using this as a training tool to expand range, it's unlikely that you're going to see huge amounts of movement because you're already at your end range. Okay? Again, you ramp it up, get that imagery of the dial. However you want to think about it, specifically on the tissues that you're trying to train, hold for the allotted time. And then after that, you would normally then dial down. So dial down slowly from, say it's 60, down to 50, 40, 30, so on and so forth, until you're then back to passive. And if you're trying to expand, you would then allow yourself to go into more passive stretch. Okay? Normally after the first one, you're going to get sort of 10, 15 degrees max. Okay, after that, even smaller, but you know, in any sort of bout of expansion, you couldn't just go straight down into the splits. All right, you're on day one. Okay, eventually you're going to run out, you're going to have given enough stimulus for that day, and then you've got to then rest, digest, adapt, and then come back. Okay, so the important things to take away is that it's an isometric tool, so there's no actual movement. We can use it for many, many things. Warm-ups, actual training, rehab, those kinds of things. We're sending decent signal to these positions, okay, decent information that is then relayed back, and our ability to then dial up that intensity over time should increase. What else? Anything else? No, you just got to try it and see. What I would say is if you're looking at some of the rotational stuff, it's not always clear where the progressive or the regressive stuff is. That's where sort of feeding back on your program can be helpful. But as a general rule, as I mentioned earlier, if I'm internally rotating here, the open side in this instance, okay, is up top. The closing side is underneath. As the resistance, as it was with the wrist, is being provided by the floor. Okay, so I push down into the floor, and that should load the stretch tissue in the top here. When I do rails contraction, I should be contracting the stuff that was on stretch. Ooh. All right, I should be contracting the stuff that is on stretch in order to help pull me deeper into that shape. It's a little bit more confusing with the rotational stuff, so pay attention to the individual videos on your program where I will then point out exactly where and how you're supposed to set that up for that particular shape. Remember, intention is more important than position. You may not always be setting things up exactly as I am in the video because you just don't have as much room, so you might be over here. But once you understand where the PAILs is and where the rails is, the setup is less important, certainly less important than the intention of the exercise. Thank you very much for your attention.